Hi there, my name is Sophie Maceros. I am a registered dental hygienist. This project is part of my health communication class at UCCS. It's called an Advocacy, Education, and Outreach project where we find a target audience and discuss a healthcare topic that may be misunderstood or has just never been presented in a way that might be helpful to our audience. So I'm going to be talking to you about fluoride and give you an overview of water fluoridation and your child's health. I just want to say thank you so much in advance for taking the time out of your day to listen to this, and hopefully you get something beneficial out of it. Just to go over some of the objectives that I have for us today, I want you guys to gain a general understanding of fluoride and its uses in preventing cavities and how it works, gain a brief understanding of the history and effectiveness behind community fluoridation, and be able to recall facts about cavity prevalence and the limitations when you have cavities, to gain insight into the fallacies behind some fluoride controversy and become familiar with parental recommendations for fluoride use and overuse. Now I'm going to be going into the basics about fluoride. It is a naturally occurring element found in oceans and groundwater. In its most popular compound, it is combined with sodium, which forms a salt that is then added to drinking water and most toothpaste to prevent dental decay. It prevents the demineralization of sound enamel and enhances the remineralization of demineralized enamel. So it prevents the tooth from becoming decayed, and if it's starting to become decayed, it fills in those areas if it's caught in time. It works by exposing enamel crystals known as hydroxyapatite to fluoride ions, thus forming fluorapatite, and it makes the tooth more resistant to the cavity-forming acid produced by Streptococcus mutans. A little bit of history behind fluoridated water. The effect of naturally occurring fluoride in water in community water has been studied since the 1930s, when a study was conducted that found that children who drank water with naturally high levels of fluoride actually had less tooth decay. And this research project spiked the interest of many people in the US. So in 1945, Grand Rapids, Michigan was the first city to add fluoride to their water system. And as of 2012, nearly 75% of the US served by community water has access to fluoridated water. This number has actually increased since 2012. It's even higher than that now. The CDC dubbed fluoridated water one of the top 10 greatest achievements in the 20th century at improving public health. Now into the facts from the CDC. Tooth decay is one of the most common chronic conditions of childhood. In the US, its untreated tooth decay can cause pain and infections that may lead to problems with eating, speaking, playing, and learning, which are all huge to child's development. About 20% of children aged 5 to 11 have at least one untreated decayed tooth. 13% of adolescents aged 12 to 19 have at least one untreated decayed tooth. Over 19% of children ages 2 through 19 have untreated cavities, and it's important to know that a child's complete preventive dental program include fluoride, twice daily brushing, wise food choices, and regular dental care. A 2012 CBS News segment looked at the effects of dental problems on education and found that in addition to lower grades, tooth problems were also found to contribute to more sick days. Dental problems accounted for 2.1 days of missed school for elementary students and 2.3 days for high school students. So those are pretty big numbers, especially considering that those are just the sick days from dental problems. Now we're going to go into the fluoride controversies. Obviously, there's a lot of controversy about fluoride, and these are just a few of the examples. There's many, but these are the ones that I hear the most often in practice. I hear water fluoridation is an unnecessary expense, and I did a little bit of research about this just to try to figure out exactly how much money goes into fluoridated water, and found that the average lifetime cost per person of fluoridate a water supply is less than the cost of one dental filling. And for most cities, every $1 invested in water fluoridation saves about $38 in dental treatment costs. Um, so those numbers are pretty helpful for us. The other controversy I hear a lot is that fluoride is poisonous. And indeed, fluoride is poisonous at very high doses, much like other medications. Um, and but what's significant is that it takes quite a bit to really become dangerous. The probable toxic dose is 5 milligrams per kilogram of body weight. And according to Columbia University College of Dental Medicine, they did a research project and they found that the lethal dose for an 8-year-old child that weighs 45 pounds would be 655 milligrams. So, to translate that into toothpaste, your child would have to consume more than 4 tubes of toothpaste to reach this level, and a 22-pound child, the lethal dose would be 320 milligrams or 2 full tubes of toothpaste. So these are really hard numbers to access there. As long as you're paying attention, I would definitely suggest, as extra precaution, to keep toothpaste out of the reach of young children if it has fluoride in it, as well as observe them brushing and spitting to make sure that they're not swallowing any of it, because it can cause some pretty immediate effects with stomach aches and stuff like that. So just be sure to watch over them with that. And like other medications, if you guys have any prescription dental products, such as fluoride supplements or, increased levels of fluoridated toothpaste, lock those up, because those actually do have enough fluoride that it could potentially kill a child if it was consumed. In general, I always say moderation is key, and I suggest that parents do their own research on their community fluoride levels. So, for example, if a child drinks a lot of tap water, which is in a fluoridated community, then they probably don't need to be using, fluoridated toothpaste and all that stuff. You don't need too much. You just need, the right amount. So be sure to look those numbers up. I've also heard that fluoride lowers IQ. There is actually no significant research, scientific evidence that supports that notion. In fact, in the most recent study conducted in New Zealand in 2011, they didn't find any correlation between IQ and water fluoridation on the developing child. And Dr. Broadbent, one of the main researchers, found that in reality the total opposite was true, as it helps reduce the tooth decay blighting the childhood of far too many New Zealanders. So he's just saying that there's actually a greater risk of them developing tooth problems than there is them actually consuming this fluoride. Water fluoridation impinges on personal freedom is another controversy, and I actually do agree with this. It does limit personal freedom, but in the cases of this, I can suggest to parents to get water sources that are free of fluoride. There's certain water filtration systems that are able to filter that out if they don't want to be consuming it in that way, but it's important that children do have access to some sort of fluoride. So if they're not drinking the water, get some toothpaste that has a little bit of it in it if you can. Actually, on the flip side too of that controversy, the community fluoridation provides cavity prevention to disadvantaged populations who do not have access to or education about dental care. So if they don't have access to a dentist, at least they have access to tap water to help protect their teeth in that way. So they do get some sort of protection, which is funded by the government. So some current research on dosages, and the Health and Human Services and environmental protection agencies help to promote safe drinking water and limit the effects of fluorosis. And fluorosis is a chronic condition caused by excessive amounts of fluoride, which is marked by mottling, pitting, or striped tooth structures. To the right, you can see an example of someone with severe fluorosis. We don't really know the circumstances of this, but we can generally assume that they were probably consuming water that was too high in fluoride back before they really had that controlled. Um, and they might have just been using, too much toothpaste. They might have just had several different forms of fluoride coming in, which can lead to that. The newest meta-analysis of fluoride therapy was published in 2011, and they concluded the effect of fluoride therapy is increased when children have a higher level of cavities, a higher concentration of fluoride in their toothpaste, greater frequency of use, and more supervision. And another article suggests that since fluoride's coming from several different places nowadays, whereas they used to have a range from 0.7 parts per million to 1.2 parts per million of fluoride in the water, they've established that it's okay to just have the lower end of 0.7 parts per million. This will actually help limit the prevalence of fluorosis, but also continue to prevent dental caries. The researchers also concluded that we don't need to be using more than a smear or rice size amount for children less than 3, because this may increase the risk for fluorosis, and no more than a pea size older than 3. Don't need to use much toothpaste. What can you do as a parent or caregiver to prevent tooth decay in your children? We suggest that their first dental checkup occurs before age 1, since obviously they have several teeth in their mouth. It's important to know if they already have a problem or prevent future problems based on what their diet is at that point or what it's going to be. It'll also provide the mother with some good information about that. They can be drinking fluoridated water or use fluoride toothpaste if older than 2. We actually don't suggest that children younger than 2 are really using fluoridated toothpaste, just as an extra precaution because of the risk. They are more at risk of swallowing toothpaste than children older than 2. Fluoride varnishes are also available at your dentist, and these can be applied as early as the first tooth erupts. It's just a very concentrated form of fluoride that gets painted onto the teeth to protect them. Fluoride supplements may be prescribed by a pediatrician or a dentist if you're not living in a fluoridated community, so that your child does actually still get the protection that they need of fluoride. Those are at safe amounts, they're FDA approved and everything. And then dental sealants are also available, and those are really effective in preventing cavities in those back molars, depending on if your child has, really deep grooves or fissures in those back molars. Those are extremely susceptible to decay because it's hard to access those with a toothbrush. So dental sealants just place a little bit of restorative material over those deep pits and fissures to help seal that up. Those are done at the dentist's office, obviously. But just as a general oversight, parents, watch your children when they're brushing their teeth, especially, at a young age, until you feel like they know what they're doing and they're not swallowing anything. Moderation is key. Make sure that they're not getting too much fluoride. And finally, do your own research. I've included all of my resources on this PowerPoint at the end of it. And if you feel the need to look up anything, the CDC and the ADA have really good resources for you to know numbers, but you can also look it up just on your community's website. You can look up their fluoride levels. That is public information. But knowing how to do your own research, make sure you're looking at credible sources, and you can always go to Google Scholar to make sure that those sources are reputable. This is just a list of the resources that I use. Like I said, I use a lot of stuff from CDC as well as ADA, and then of course that CBS News thing, but there's several other places that I grabbed my information from, so feel free to take a look at any of those. And there's just some more. And last but not least, your feedback is actually part of my grade for this project. So if you have any sort of feedback, if you feel like you learned a good amount, or if you feel like you still have questions, anything, honest feedback is more than welcome. I would love to hear from you guys, and just go ahead and shoot me an email or post it in the comments section of this when you are done. I just want to say thank you so much again for taking time out of your precious day, and I hope you got something good out of it.